Welcome back to season 2 of the Pregnant Bitches podcast.
I'm Jessie.
And I'm Amanda.
And we're just a couple pregnant bitches navigating motherhood together. Welcome back to the Pregnant Bitches podcast. Today we have such an exciting guest. We have Nicole here, who is a C-section recovery expert. She herself has had 3 kids and 3 C-sections, so she actually knows what the fuck she's talking about when it comes to this stuff. And I know this is a huge topic that everybody wanted to know about. Both Amanda and I haven't had C-sections, so we needed to bring Nicole on today to give us the lowdown on C-section.
Give us everything. We're so excited. I really want to learn about it. People have even asked me, I'm like, I haven't had a C-section, so I can't talk about it, but that's why we have Nicole on today. So let's just dive straight into it.
So Nicole, will you tell us a bit about yourself, your background? We just want to give our listeners a little briefing about you.
For sure. Thank you so much for having me. It is such an honor to be here to share this information because it's not talked about enough, obviously. My name is Nicole Alfred. I am a C-section recovery coach online. I'm the founder of the C-section recovery method, my 12-week online program to help moms heal from a C-section in less time with less stress. But I'm foundationally am a registered massage therapist here in the GTA, the Toronto area in Canada, and I have been for over 20 years, with a focus in pre and postnatal recovery and preparation, obviously, for birth. I'm also a doula, so that's kind of what got me started in this birthing world as well. Like you said, I've had 3 of my own C-sections. My first was an emergency with a uterus tear during the emergency. So it was a very traumatic experience. And then my last 2 were planned cesareans, my second during COVID, which was shit. And it was like literally a couple of days into COVID.
God. That's when your husband or partner could not come in, correct?
No, he could. But the thing is, they didn't know day to day. So like I'm a planner and I wanted to plan the shit out of that birth. And it was like, oh, we don't know what the rules are going to be tomorrow. I'm like, that is not good enough for me.
No, oh my goodness.
Oh my God.
So it ended up being a really incredible experience. It felt like The Walking Dead when you left the hospital though, because nobody was there. It was like deserted.
Right.
So that was odd, but gave birth to my 3rd cesarean, my second daughter in October last year. And it was like the best possible recovery. My mom was able to come because she lives in the US. So she wasn't able to come with my second baby. And I had her supporting me. I had a plan for recovery, which is what I teach. I was almost pain-free by day 5, which is crazy to think about after a major abdominal surgery and being in postpartum. And I'm here today, almost 8 months postpartum, to talk to you guys all about this.
Love that. Love that.
Help people so that they can feel empowered in their births, but also in their recovery so they can get back to feeling normal again because we deserve that.
Yes. Yeah, I agree. I love that. So I'm going to start you off. Are you ready for me? Here we go.
I think we're going to need like a 2-part.
Yeah, we may. So the biggest question is, and now knowing that your first one was an emergency C-section, so we can totally start with that, is if someone is about to have an emergency C-section, what happens? Like, what is the first step?
The first step is that they notify the patient that this is how we have to go. Whether the person's in active labor or not, because sometimes you'll go to the hospital to get checked out because maybe your blood pressure is high or low amniotic fluid, or there's something else going on health-wise with you or concern with the baby. So it's not necessarily you're always in labor when you have an emergency. Right. It's just basically being unprepared. Right. Then you go into that. So they notify you, they let you know that this is what's going to happen. They, if you already are in labor and you have an epidural, they don't put a spinal in or anything because it's already there for numbing. But if you don't already have that, that's the first thing they do is they prep you in the OR to get that spinal so that basically you can't feel anything from your chest down.
Right.
Which is the worst feeling in the world, by the way.
Really? What? Like you just can't feel.
When you're in an emergency situation, it's all happening so quick. And if you're in labor for so many hours, like I was, like for almost 40 hours, you're exhausted.
Yeah.
And so I know. And so this last time I really had to like talk myself to like breathe through it when the numbing was taking effect. So once they put the numbing in, they lay you down on your back and then they start hooking you up to some of the like monitors and that. Actually, before the spinal, they actually put you IV into you if you don't already have that. And then the anesthesiologist is there with you, and the obstetrician is there who's doing the surgery, and then all the like nursing staff. If it's not an emergency, they all get introduced to you. Otherwise, everyone is like literally trying to save lives here, right? So they're really quick. And a lot of times people don't feel empowered because there's no time to really tell you anything.
Right.
Like sometimes they literally have to just like get that baby out of you ASAP.
Right.
Right. So
it's scary.
You know, once you have all those medicines in your body numbing you and the IV and the anesthesiologist is with you and they start, you know, they have to test out the skin first to make sure you can't feel it. Cause I've heard stories, which makes me want to throw up.
Stop, that it didn't
I've heard
work.
that also, that it didn't work and you felt, my girlfriend, it happened to my girlfriend. She felt, they were like, and her OB didn't believe her. It was like a really crazy thing. They started cutting her and she's like, I feel my stomach getting cut. It was a whole crazy thing.
The most you should feel is like pressure. So I remember with my first, because my son was so freaking huge. He was like 10.9 pounds with a giant head. I know. I was like, I'm having a home birth. Stupid.
Yeah, no.
Stupid.
I'm so naive. But I mean, like, I had the best intentions, right? Like, I wanted to I knew my body could do it, right? So anyways, they had to push him back up me because I'd already tried to push.
Oh.
So basically, it sounds really graphic, but my midwife had to like get the glove on and shove her arm, and
oh my God.
I didn't even know that was a thing.
Oh yeah. If you are already trying to push the baby and the baby's starting to descend and then they have to do an emergency, they have to push the baby back up you into your uterus so that they can pull the baby out of you. Because
it's not there anymore.
You're getting fisted.
Yeah, pretty much. After I was like, why does my pelvic bones feel so flat, like so like cracky and flexible? And I realized it was because of that. I mean, you have the relaxin hormone, right? So you are more flexible for that reason, especially if you were in labor, you have all those hormones anyways.
Right.
So it's not like it ruined me or whatever. But so anyways, they make sure you can't feel anything. But again, if you can, it's usually just the pressure. Like I felt like I was being beat up.
Oh God.
Like, why is this so rough? And it's again, because something I didn't expect it. I didn't want to have a cesarean. I wasn't expecting it.
Right.
But it can feel like they're kind of punching you a little bit because they have their incisions only like this big. Right. And they're getting a full baby out of there. Unless you have like a teeny tiny baby. Like mine are never, my babies are always like 9'6", 9'5", 9'11".
I love it. I love it.
I have chunky babies. So, they're squeezing a little baby through an incision that they've made in your skin. So
it's like, pressure, it's pulling.
I've heard like people also get like headaches, shivers, itchy, like from all the meds. Is that common?
So that stuff is usually happening after. The shivers can definitely happen during. So if you have great care team, they'll be putting like the warm blankets on you because your arms are actually laid out on the sides with all like the IVs and everything.
The IVs. You're literally like this. Oh, God.
So you're kind of like this. They should not be pinning your arms down unless there's like a medical reason, like you're delusional and you're just like, or whatever the reason is. But generally they don't practice that like that anymore. And so basically once you start shivering, they give you that, you can start to throw up. And again, it's like this, it can happen, I think also because when the numbing is happening, you almost feel like you can't breathe. And you have to just like,
my God, I didn't. Wow.
Because you're losing control over your body.
It's a very different experience. Of your body and you're awake. So
you're totally aware, but like you can't do anything.
You can't move. And so you really just have to like this time, this is what I did was I just was like, okay, breathe. And I just talking myself through it. And they were like, are you okay? And I'm just like, I just like trying to breathe right now.
Right.
But I think for people who feel very out of control, which is contributes to the trauma.
Right.
You can start having panic attacks and throwing up and all that stuff can start happening during, but you do have the anesthesiologist like literally at your head.
Right. So they don't leave your side.
You found that breathing through it and like just having a bit of an expectation of what, or like knowing what to expect really helped you get through that first.
It's cold in the OR. It's definitely cold in the operating room. I never convulse, but some people do. So that's definitely normal and they'll do whatever they can to kind of help you through it. But I know for me, once they had to push him back up me and they took him out, my uterus actually tore down into my cervix from my incision.
Wow.
And that's not normal. I just want to say that's not normal. It's because I'd have been in labor for like almost 40 hours. My baby was ginormous. My uterus was like really thinned out. And just the whole like action of everything, just the pressure, it just caused my uterus to tear. So they did put me under general anesthesia, which is another thing that could happen if you if they don't have time to put a spinal in, right? If they don't have time and it's like literally life saving, that is what they're doing. They will put you under general anesthesia. And that can be really hard because you're like literally missing the whole birth. And if birth is something that was like really important to you to experience,
that's tough.
And all that,
I never thought about it that way.
Hard.
That's really tough.
Yeah. So they put me under once I saw my son and they realized the tear was there. They were like, okay, bye-bye. I'm like, yeah, I need to go. This is too much. Like, I know too much I know medical terminology. I know what you're saying. Like, I need to go. I can't.
You're like, no, this is not good. Oh my God. So how long does the procedure normally take? Like in an emergent is one
emergency
thing.
You wouldn't know, but if
it's like 45 minutes, right?
Yeah.
And it's about like 10 to 15 in the first 10 to 15 minutes of them actually doing the surgery. Not the setup is when the baby actually comes out. And then the rest of it is literally them just like sewing up layers. And the layers that they sew up really depend on the obstetrician. Some, I've heard people more in the US, like they actually sew up the ab muscles that get displaced. They're not cutting through muscles. So they more kind of like pull them apart. But some of them will sew up like the fat layer. Some won't. They'll just place it close together. But they definitely are sewing up like your uterus. They're sewing up like deep fascia. They're sewing up your skin.
Wow.
Some use glue. Some use
cut you open.
It's like what, 7 layers of stuff you have to get through?
Major layers. Yeah. I have like a video on my Instagram that like went viral a few years ago because I was showing with felt all the different layers. That
smart. So people can see
because you don't think of it, right?
Yeah.
Like when you look down, you see like an outside incision, you see an outside scar, and you think, okay, that's it. It's like, no, like that's really deep.
Deep down. You're so right. I've seen my friends see C-section scars, and I'm like, oh, this doesn't look so bad.
Yeah.
No, but because like she said, it's just a little tiny incision. Small, and they're getting the baby out. Like, wow, that's crazy.
So they actually use like they have to, once they cut you open, they actually have to like kind of pull things apart, like your bladder, they move the bladder out of the way. Yeah, well, it's surgery, and that's the thing is like
it's major surgery.
It's so downplayed by society, by people. It's like C-section. It's like no, like if you can avoid it, avoid it. If you can't, it is what it is. Like let's make the best of it. And that's honestly my opinion with it. Because it is a major surgery. And the reality is, and we'll get into this, is that like no one has given anything except for incision care as far as how to help themselves heal.
That's it.
If you go for a knee surgery, you get full rehab for 6 weeks and connection with like practitioners and all of that stuff. You don't get that. And so it's like, you have to understand that it's major. And just because you're feeling like you want to be active because that's your sense of control at like 2 weeks postpartum, doesn't mean you should be going and doing anything crazy. Like your incision is still healing.
And we're not told. And that's why you're here today, because women are not just women, everyone, but especially women, are not told how to take care of themselves post C-section.
No, it's ridiculous. It's actually ridiculous.
How are you feeling? Great. Right? That's how we got it with vaginal deliveries. Yeah. But I've heard it's like, how are you feeling? Great. And they don't even check you. Like
that's crap, right? Like I think childbirth in general in North America is just it's not prioritized in the healthcare system. When you hear about countries like France that they get sent to pelvic physio right away, and it's just
everything.
You like when you think about a cesarean, it's not just surgery, it's not just birth. You're also taking care of a brand new baby as you're healing from this birth. Like there's some vaginal deliveries that are very traumatic physically. 100%. To the body, right? You can't get up and you can't move easily. And so, when you think about that, it's just crazy that we get into these mindsets of like, I have to just still do it all, even though my body is like injured right now.
And society expects you to do it all. That's what it is. Society has put it out there to say, this is normal.
Yeah.
But it's not normal. It's not like that for them, for society, for everyone around, it's normal. But this is not normal. Like you just had full surgery. and let's take care of you because this is a real thing. And like you said, you have a child at home. Maybe you have 2 children at home. Maybe this is your 3rd one.
Yeah.
Which is literally what happened to her.
Exactly.
That was one of my biggest questions all along was at the, you come home. Now we've had our second. I just had my second. Like my older one is like running around, wants to be picked up by me.
Oh,
like
God.
if I had a C-section, like what do you do? Like you can't lift, even if it's your first and it's a C-section, like you're not supposed to lift or move anything. You've had major surgery. Like, what did you do? Like, how do you coach people through that?
It's crazy because like my first 2 are 6 years apart. And then and then my last 2 are 3 years apart. So, I had a preschooler, not a toddler. She was a preschooler, right? Because she was 3.
Right.
And even like that's a pain in the ass. Like you're, trying to take care of the baby or get babies to sleep or do anything. And like, you're very on edge because you're postpartum. And the kids don't want to be quiet or they want your attention. And you're like, but I can't, or it's cold and freaking flu season, which is what I went through.
And good on you.
She gave my daughter RSV. I had to go to the hospital with her at 8 weeks postpartum because she had RSV. She couldn't breathe. And it was like, I had never had a fall winter baby. I always had spring babies.
It's very hard.
Experience that. And also my first 2 are 6 years apart. Like he knew not to go in her face. Whereas hers, like, get away, but you want to know what we mean. I think like the general expectation in birth postpartum is whether you vaginally deliver or cesarean is like you should not be lifting, you should not be trying to do things that you did before. So if your child needs hugs or needs to be connected to you physically, like you're sitting, you're laying down, you're snuggling, making sure that you have people who either help you take care of the other kids. So that you could just focus on the baby or have things set up for you. So whatever station or area of the house you're going to be hanging out in all day with the older kids, then make sure that you have snacks for them, for you, drinks.
That makes sense.
Like smart. You're not having to get up a million times a day to go to the washroom and do and go to the fridge and do all these things. So if your child's like potty training, you have potty right beside you. Like you got to make do with what you have.
Totally.
Be prepared.
Be prepared, right? No matter, I think in birth, like just be prepared for anything because, you could have had the most healthiest pregnancy, healthy, beginning of your birth. And then all of a sudden baby's heart rate drops and they're like, this is not good. We need to get the baby out now. Right. And now you have a cesarean. It's like, you weren't prepared for that. So I think go in with the mindset of like, I'm birthing my baby and I'm hoping that it's going to be vaginal. But be prepared for it all.
Right. I really like that, like exactly what you're saying. Like I had no idea about C-sections or anything, but like that totally could have happened to me.
100%.
And someone who's like such a control freak, I would have panicked. I would have went into full panic.
Well, a lot of people like they push for 2 hours and then if they can't get that baby out for whatever reason, they're like, this baby needs to come out now and they have to go to C-section.
Right.
So I feel like the burning questions from everybody is like, how do you recover from a C-section well? Like, what are your tips? Like
your top
the
tips,
immediate recovery tips. Like, how do they like take care of the incision well? Like, what are the meds you're supposed to take? Like recommended undies, apparel, like all those important things. Like you said, you didn't have pain after 5 days of your last C-section. Like what did you do?
Give them like all they want.
Okay, there's so many things there. Okay, so let's talk about the hospital. So in recovery, the nurses, they're going to be getting, so once you've had your cesarean, you get pushed into the recovery area. You're there for a bit so they can monitor you and, take some things out and whatever. And then you get pulled into postpartum and that's where you're going to be staying for hopefully only 2 days, if not sometimes more, depending on what's going on with you and baby.
Okay.
And then within that first day, probably about like 6 to 9 hours, sometimes it takes for them to then get you out of bed. So here in Ontario, I know a lot of the hospitals, because it's different everywhere, they put like leg pumps on you as to prevent blood clots. If you've lost blood like I did during my first, you're getting some blood put back in you.
Is it your blood or someone else?
No, it's a blood transfusion.
Oh my God.
A blood transfusion. And I actually got like an antibody issue with it.
Oh God.
For my transfusion, it's called anti-K. And like, if it's genetic, it can cause anemia in your baby and they have to have blood transfusions while you're pregnant. But if you
Oh my
acquired
God.
it, yeah, I know. It was so stressful with my second. If you've acquired it, then it's not going to go into the baby and you'll be fine. But otherwise,
Right.
if it was something genetic, like from my husband to the baby, my body thinks that the baby is an invader and will attack it and try to kill it.
Oh my God.
Yeah.
I just
And
got
it's like,
chills.
is this whole thing? And I got this antibody, it's called anti-K, from the transfusion. I'm like,
Fuck.
why didn't you test for that? Because like,
Yeah, literally.
I have it now in my blood, this anti-K. So
Oh my
if I
God.
ever need blood, I have to have like the same type of blood I have. Otherwise my body will reject it.
Right.
And I'm not allowed to donate red blood cells now. I can donate plasma, which is like the outside,
Wow.
and actual cells. I'm like that should have been a thing. But anyway,
Yeah.
So it is what it is. So you'll get blood transfusion if you need it. They get you comfortable. You're kind of in shock if it's an emergency C-section. You're just like, what the hell just happened to me? If you're planned cesarean, it is amazing. And your baby is on you and you're just like so in love. You're just like, it's the best experience ever if you can have a planned one.
That's what I've heard. I've had a couple friends that have planned. They're like, of course we're doing a plan the second time. Like it was amazing. They said the word amazing.
A lot of people, they have the emergency first and then they have the plan second because they don't want you to have the vaginal. Why is
it's
that?
It's actually changed. It's so for me, because of the tear, no, I'm not allowed to go into labor because my uterus can like rupture, right? If I go into labor. But it's actually like, if you look at the Society of Obstetrics, they actually do support VBAC. As long as it's been about almost 2 years, 18 months to 2 years between your births, right? So as long as you're waiting that long, and again, it depends on why you had your cesarean. If you had your cesarean because of breech or baby's heart rate or cord wrapped around the neck or anything like that, then you could be a candidate for having a VBAC, which is a vaginal birth after cesarean. And some women who have the trauma from the first, I find, don't even want to attempt a VBAC because they're like, what if
it happens again? And then you have to emergency again.
And then it's an emergency.
I know one of my friends, she's like, I'm not even chancing it. I'm doing C-section like
so
again.
That's where
that's what I've heard a lot.
Therapy is so helpful. It took me too long to go to therapy, but therapy is so helpful to help you process and feel validated by what you went through. Because the bullshit thing is that people who love you the most and don't mean to harm you emotionally will say, oh, well, at least you and the baby are healthy. That's all that matters. And you're like, what the hell? I just went through like the hardest thing emotionally as an adult, giving birth to my baby, and you're minimizing it like that. But they don't mean to. It's just, they can't relate, or they're maybe being triggered by your birth story or how you went through something so difficult and they don't know what to say. And so what they end up saying is something that's very minimizing. Or, you get partners, or husbands who look at, what doctors are saying and what their relatives have gone through with cesareans. And it's like, oh, you're 6 weeks, you should be good now. Like you can start helping out again.
I hate that.
No, because none of them knew what they were doing, and they all thought they were just supposed to go back to things too, because that's what the doctor said, and that's false. So
I hate that. I hate that they've made a marker and said 6 weeks and you're good to go and
they base it on nothing.
What are they basing 6 weeks on?
Well, first of all, they give people who birth vaginally and cesarean the same advice: 6 weeks.
Oh, that makes no sense. Really normal. That makes absolute. No, that's fucked up. Sorry, that's really fucked up.
It is. 6 weeks is like tissue health, or tissue connection. So your actual scar healing should be by 6 to 8 weeks, should be fully healed. No risk of infection. You don't have to go have another surgery because they have to drain it. None of that. Same with like your uterus and your organs. Everything ideally should have kind of gone back into its place, because everything moves when you're pregnant to make room for the baby. So physiologically, hormonally, not necessarily, but like just the way that your body is internally should be kind of healed around that time. But the problem is that doctors will say like, go back to regular life. And it's like,
okay, regular life.
Half of them don't even look at you, don't even touch you. It's very rare that they do actually do a proper assessment to be able to say, go back to exercise, have sex, do all these things. Like,
they cut through 19 layers of your skin and they're like, so peace.
I didn't have a C-section. I'm not comparing it, but I had a breast reduction. And
that's major too.
It's major. I had a breast reduction and a breast lift, and I had the stitches, and they had to take out the stitches. But the amount of times that I went in for follow-ups was many follow-ups, many phone calls. And to me, I'm like, so in my head, that's what I thought you'd get from a C-section. Like if you had a C-section, you're going in, they're checking your stitches, they're seeing how you are. Nothing.
I saw someone post something the other day, but like I had like ACL surgery and like had to go through all these things and all this prep and all this blah, 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 and then I got a C-section like a year later and it was like, bye.
Go home. See ya. Good luck. Good luck to you.
Like so many people that contact me to work with me in the program are like, I've had a previous orthopedic surgery or my husband. Right. So I understand that there has to be more than what they gave me to go home and like recover properly. But let's go back to like the early recovery, because this is really where it starts. And it's literally just like you're in that postpartum suite and you literally can start by moving your body. You want to prevent that gas buildup in your chest because that can be really painful because the air can kind of get trapped from them when they open you up.
Why, they pump air into you?
No, they don't pump air into you. It's just that it can go in while they've opened you up and all the pressures and all that. So you want, and you're not moving, right? Like you're laying in bed. So what you want to do is really get the arms moving, the legs, the neck, get all those things moving to kind of like bring blood flow, bring lymphatic flow, and like also just like get rid of that gas. The most important thing that I focused on for my 2 planned cesareans was digestion. The reason is because after my first emergency cesarean and I lost so much blood and had to get blood transfusions, I was constipated for like probably 3 to 5 months. And it was like so painful, worse than labor, because I was in active labor for a very long time. So I can compare this. It was worse than labor pains when you would feel like your poop moving through your intestine to come out. Because what happens is like your organs kind of like go flaccid a bit while you're in surgery, right? Because of the numbing. And because you're in surgery. So everything kind of, that's why they don't want you eating 12 hours before you have a cesarean, because they want to make sure there's nothing that needs to come out. It can cause complications.
They should do like, what do they do when they flush you out?
Like an enema?
No, but like, what do they do when
like a colonoscopy?
A colonoscopy.
And flush.
Yeah,
I don't think
just like flush you out before.
Shove it up their ass while they're going through any of that.
Just start shoving everything up their hands.
They give you stool softeners in the hospital, but I work with naturopathic doctors every time I have a baby, and like they suggest like, and I can't give dosages and all that because it's out of my scope of practice. But if anyone has like a health food store or a naturopath or a nutritionist that they want to work with, but it was things like vitamins, high dose vitamin C. It was magnesium citrate.
Yeah, magnesium.
I was taking arnica, which arnica was recommended to my friend who actually had a tummy tuck, and her tummy tuck surgery and recovery was so much more like empowering and supportive than her cesarean.
That's insane.
So fucked up. Yeah, of course. Breast reduction, boobs, tummy tuck. No, we're here for you.
They put her
you birth the baby.
That's my commercial. We're here for you.
Yeah, because you're paying for it, right? But there's still
that's what it is. That's exactly what it is.
Right. So it's like, okay, well, if she's taking it, I'm sure and so I talked to my naturopath. She's like, yep, arnica. And arnica is great because it can help with like the swelling and the bruising. So things like that, eating really clean if you're having a planned one. Or if you're not sure and you know you're in labor, just eat really clean. Like don't be eating like pizza and crap that's just going to clog you up, right? Eat easy to digest foods, and in postpartum too, like easy to digest foods in postpartum and when you're preparing, because again, you don't want to overload your system that's just trying to turn back on. So my goal with my last 2 cesareans was to poop in the hospital before I left, and the next day I always poo.
Wow, good for you.
And it comes out like,
makes sense.
I'll be graphic here. Like there's a lot of gas. So like, it feels like it's exploding out of you. You're like, whoa,
I love it.
But you know, it's again, all the gas moving through your intestines, everything's coming out, and it's again, things turning back on, and you got to keep that going for at least the first couple of weeks to avoid that constipation from happening. Avoid straws that can cause gas. So if you're going to be drinking out of one of those tumblers, make sure it has like a lid that opens. You can drink out of.
Good tip.
That's a great tip.
And chewing gum can be also really helpful. Apparently, there's been a study with chewing gum to reduce gas, because chewing gum stimulates something in your mouth and your brain. It tells your stomach to start digesting things. So again, it's like turning on the GI tract.
So you really just want to get stuff going as soon as possible so that there's no buildup. Because it sounds like if you have like the buildup, then that's what's the pain.
It causes more pain. So, and if you think about where you're going to be bloated, it's that lower stomach where you have the incision, right? So if your digestion is going and your gas is gone, that's going to help you with your pain.
No, it makes sense. Like it's all connected. It's all there. I remember it's obviously different vaginally, but she was always like, always empty your bladder because you don't want your bladder to put pressure on your uterus as you're like healing. So it's all the same thing. Like you don't want.
Everything's connected.
Everything's connected. And then the last thing is like, you got to move at least every 2 hours. Once they allow you to get up out of bed, you got to move every 2 hours. And the way that I do is just getting in out of bed. And again, it's like baby steps, right? So the first time maybe it's just getting out of bed by yourself and then you're sitting back down. The next time, every 2 hours from 2 hours from then you get out of bed and maybe you walk to the end of your bed or to the other side of the room and you come back. Maybe next time you do all that. Plus then you add on like marching in a spot. And when I say marching in a spot, your feet are lifting off the ground like half a foot, right?
It's just something.
The next time you're lifting your foot higher. And then the next time maybe you're adding in a gentle, shallow squat.
Right.
So marching and squatting are key because again, you're going to have to like learn how to walk again, learn how to get it in and out of cars, up and down the stairs. Like these movements is what's really going to help you.
And is all this because they just numbed you for so long? Like why
you have it's the cut, like you have major surgery. You can't, one of the questions was you can't be in the car, right? You can't drive. There's a certain amount of time where you can't drive post C-section, right?
Yeah, part of that's the narcotics that if you are still taking a lot of pain meds, it's going to delay your response, right, while you're driving. Also, you're freaking tired. Like, who the hell is like with it in those first couple of weeks to be safely driving? And then the other thing too is that your muscles, like specifically, let's say your hip flexor muscles, which are at the front of your hip here, have to learn how to turn back on again so that you could lift your foot and, press the pedals.
That's because they turn your body off.
Yeah. Well, it's also like, it's the surgery. It's also like you were pregnant, right? Like even after vaginal delivery, you're not like up in like power walking with the girls after, like you're just like kind of moving. Oh my God. Along. So those are kind of the key ones. And then the other thing too, before you leave the hospital, like bring your stroller up so you have something to hold on to push the baby out of the hospital. Like I gave birth in Oakville in Ontario here. And that like parking lot to like postpartum suite is so far. And you don't want to be, if you don't have to, if you're able to like walk it, that's like a really long walk, but you could build up to that over the 2 days that you're there. Like you can start walking hallways and stuff. But ideally you want to be able to walk it because again, you don't want to be stagnant. That's not good for your digestion. It's not good for your pain levels. It's not good for your body to be able to turn those muscles back on again, like your spinal muscles and your core muscles.
So it sounds like if you can power through those first couple days postpartum and like really try and walk and push yourself, obviously within reason, like your recovery could make like you could make a faster recovery on the other end or less painful.
I will say with my first though, when they were like, okay, get out of bed. I was like, excuse me, you just cut me open from side to side. Like I'm not getting out of bed. And they were like, get your ass out of bed.
Oh, they push you.
And I was like, oh my God, I can't. But then, so I had a very different attitude with my other ones because I knew like, okay, I'm not going to just like break open and fall onto the floor.
Right.
And, I think that like the planned cesarean allows you that kind of mental preparation that, okay, this is major and this is, I'm going to have to just be kind to myself. And it's going to be frustrating when your baby's like crying or needing you and you're like, I can't get up and I can't go help them.
That breaks my heart.
And I need to like ask someone to do this for me or do that. And you can't just like move freely as well in bed. One thing I want to say about going home though, and I just discovered this week because my grandmother just came home from the hospital as well. And I had to set up like a bed rail for her.
Right.
It goes under the mattress on the side that you're sleeping. And it literally is just like a rail. So you can like pull yourself up.
That's so smart.
That's a very good
Amazon.
tip.
Right. Just
there
order it online. And it's a great one because it's going to give you that bed rail that, yes, there's no button to press to like make you go inclined, which is helpful.
But you can pull yourself up.
And it gives you some independence without having to call everybody.
Adding it to my Amazon.
Yeah.
So if let's say now you're at home and you're recovering at home, like how do people breastfeed comfortably with the C-section? Because I feel like your position is like, are you supposed to be on your back more? Are you supposed to be sitting? Like
most people can't lay on their side after a cesarean. It's difficult, especially if it was an emergency, because your body is just so sore from being in labor too.
Right.
And you likely didn't move very much after because you're just in shock. So ideally you want to try like the different like holds, like the football hold, the crossbody. If you're doing crossbody, you want to have like a breastfeeding pillow.
Right.
No,
that can go over.
Like,
yeah.
Right.
Like here.
And the thing is too, with breastfeeding is, and I've been through this, is that like, and I knew this professionally as a doula, like they're going to tell your baby's lost like a ton of weight before you leave the hospital. And they're just scare the crap out of you that you need to start like supplementing and doing all this, because with the surgery, with the IV, your baby actually gets some of that fluid in their body. And so it's normal for them to like lose more. And also, and my doctor gave me really good perspective a week later about this. And she's like, you had big babies. Like, we're not really concerned if they've lost a pound. Like, if you had a teeny tiny baby or preemie, like totally different.
Makes a difference.
And she's like, they shouldn't have scared you like that. But I already knew I was having my planned. I was at the breastfeeding clinic, the day before, because I had to go, you have to go for tests the day before to make sure you're healthy enough for surgery and all that.
Right.
And I went to the breastfeeding clinic and was like, I'm going to be here tomorrow. Can you guys come and do a round to visit me? Because when I gave birth during COVID, there was no breastfeeding help.
Yeah. Oh my God.
Everything was shut down. And my daughter ended up having tongue ties, and I had to go to Toronto to a breastfeeding clinic with a renowned doctor there and get all that work done. But, so I would say make sure that the breastfeeding nurses are coming by, making a plan with you. Also, a midwife friend told me this years ago, like have a breastfeeding plan, because if it's not going right, it's not going the way you expected.
Right.
And you're going to put more pressure on yourself to breastfeed if you didn't get that vaginal delivery and it was an emergency, and you're going to start sinking down mentally. Into a dark hole, and you don't want to go there because that's it's not what it is.
Like breastfeeding's already hard enough when you don't have all that physical recovery.
Yeah.
Like I can only imagine like the stress and anxiety plus dealing with this huge physical like recovery. It's probably
breastfeeding hurts in the beginning. Right. You have this incision that hurts it. Like you're basically your entire body. You're like, help.
Yeah. Well, and also your body is trying to heal from surgery and it's trying to produce milk at the same time. Like,
oh my God.
I never thought about it that way. Fuck.
With vaginal delivery comes in, when did your milks come in? Like a couple of days, 1 to 2 days?
2 days. Yeah.
2 days.
But I had colostrum for like weeks before.
So if you think about, that for an emergency cesarean, they may be having colostrum as well, especially if they are past 38 weeks, almost 40, sometimes 42 weeks. But with the body going in through surgery and it's kind of in shock, it can, with a planned and an emergency, take up to 5 days.
Wow.
Which it did for me because I had lost so much blood with my first. It took 5 days. And then with a planned one too, you're literally pregnant 1 minute and then you're not the next. So your body didn't go through those processes.
I was going to ask that because someone was like, does a baby know if
that was one of the questions?
Yeah, like did a baby know if it came out of a vagina or a stomach? Like, does it know the difference? I don't know.
No, it was like
one of the myths.
It was like, do you still have the same connection if like your baby's going through the vagina or like through your stomach? Do you have the same connection? Does the baby have the same connection?
I feel like the only thing that knows the difference is your boobs.
Literally,
your boobs get told the message if it comes out this way.
But your boobs don't get told the message
if it's a C-section.
So it could be like 5 days. So if
it's a planned, if it's a planned, it takes time,
because if it's emergency, you went into labor.
You went into labor and you started the process, so your boobs knew what they were doing.
Yeah.
Come on, figure it out.
It's like they take the placenta out too after the baby comes out, right? So like once that happens, the reactions do start happening. But again, like your body is focusing on, that's why they say don't eat before you go for a run. Right. Because like the blood flow and everything has to go to your digestion. And if you're going for a run, it's trying to go to your quads and your hamstrings and your glutes, right? And then you get cramps. So it's like your body's trying to focus on healing you after surgery. And, now you're putting more stress on it to like breastfeed, and it's going to happen. It just takes longer and it's stressful because it takes longer. And then your baby's losing weight maybe there's a latch issue. You know, the baby not going through the squeeze of the birth canal can definitely impact alignment in their mouth, in their palate, right? In the roof of their mouth. I bring my babies always to an osteopath to get that worked on because I didn't go through the squeeze. But as far
going through the squeeze of the birth canal does something to their jaw?
Like the skull, like the bones kind of go over, everything kind of squeezes, right? That's why C-section babies have these like perfectly round heads, and vaginals like you get like cone heads.
Yeah, both my babies had like serious cone heads.
Yes.
It looked like that that sci-fi movie.
I never thought about it that way. Speaking of that, so after you have your C-section, does the doctor tell you that it might take 5 days for your milk to come in?
Well, you're not really talking to the doctor after. Nurses. The doctors kind of go away. It's all nurses.
Do the nurses explain to you that you may not get milk for 5 days?
Yeah, they should be realistic in telling people that it could take longer for it to come in.
Right.
But I know for me, like, you know, because I was in postpartum and I don't know, I just was like, okay, like we're trying to breastfeed, you know, the latch sounds kind of weird, like what's going on? And they were like, the charge nurse won't let you leave unless we give you a plan and we want you to be on formula. And I was like, why? Like my milk's going to come in. And they were like, no. And then they guilted me into using formula for her with a straw at my nipple. So I had I had my mom holding the bottle. My husband was holding the formula bottle with the straw, and my mom was holding it at my nipple and trying to get it into my baby's mouth as I was trying to get my nipple into her mouth.
Oh my God.
So that we didn't have nipple confusion. This is what I did this last time. It was so stressful.
Whoa.
It was so stressful. So, you know, some people are using like sheep nipple shields. Like, so it can be really hard. So I think at the end of the day is like, you know, bring your pump to the hospital. That's something that they don't usually tell you.
Yeah.
Bring
vaginal, on our hospital list.
It's on our hospital bag list.
Yeah. Vaginal or cesarean. Because vaginal, if you don't want medication and you actually want to keep your contractions going, nipple stimulation with the breast pump, they made me take it off. They were like, your contractions are too far. Take it off. But it works. It does work. And it's also great in postpartum to try to get that colostrum, especially with a plan where your body's in shock, right? But yeah, like as far as bonding, I don't know, like I've never vaginally delivered. So maybe you can share, like, did it take long for you to bond to your baby? Because it took me a long time with my first.
I feel like I never really had that like initial, like, oh my God. I was like, thank God it's fucking out. Like, so I was just like, I've been pushing for 2 hours. Like,
oh my God.
I'm so relieved. Or like this last time I did it unmedicated. So I was like, it's over. Thank God.
Right.
Like it was more just like, it's over. Right. Less like.
I had it with my first. I cried and my husband cried. And like, I've maybe seen him cry twice. And that was, so I had it with my first. With my second, I was like, I need food. I was like, you're good. I'm good. Like, here you go, daddy. I need food. But I did have it with my first, but I didn't have it with my second. And at first I was like, is this supposed to happen? Like, I felt bad in a way. I was like, I was so emotional with the first, and the second, I don't know.
No one talks about that though, right? Like,
no, I felt guilty.
100%. You feel guilt.
And I also felt guilty. Like, why did my husband not cry the second time around? But then I like gave, I don't know. Like, I kind of was like, we experienced it. I feel like the first time also, it's like a whole new shock experience where like,
this is your first.
My kids are also 16 months apart. So it kind of was like, boom, boom. Like I felt like we were just there.
You live there.
I'm one with the hospital.
But I feel like I will say the easier the birth, I feel like you yourself start to feel better faster. Like this second time around, I didn't have medication. So within less than 24 hours, I felt great. And I think that's the clock that started the bonding is like, I felt good. So therefore I can
that's very fair.
Start to like enjoy this versus just feel like I'm in a fucking daze of pain and stitches and burning and shit and whatever. Else you feel.
Right.
It's similar to like when you're having a cesarean, like the emergency is just harder. And so it is normal to not feel that initial like burst of love. Right. But I also think that like when you vaginally deliver your baby and all those hormones are being released by your body for bonding, You're not getting that with a cesarean.
Yeah.
But what a study found back in 2014, when I did give birth to my first, that if they can do skin to skin immediately, as soon as the baby comes out during a cesarean, which not usually during an emergency because it's an emergency.
Right.
And as long as when they pull the baby out, even if it's planned and baby looks okay, and they bring them over to the warmer to check them out and like they're good, they can put you skin to skin with the baby.
Right.
And that is supposed to like imitate what you have had when the baby comes out and you go straight to your chest.
Right.
And they're trying to see, because they were trying to study, like, does this help with decreased postpartum depression, improvement in bonding, improvement in breastfeeding? And it does.
I believe that.
I totally believe that.
Because you're missing that stage of it coming out, but then if you can just copy the exact same process after,
like that
part
getting,
should
like the hormonal release that you do get when that golden hour is what they call it. You can still create your own golden hour with baby being skin to skin. Like, so as soon as they cleaned her up and like checked her out, they brought her right to me and she didn't leave me until I was in like probably for like 2 hours, 2-3 hours.
Love
until
that.
I was in like
like
recovery.
why can't they put them on you while they stitch you up? Like what are like
and they do. They will. It's just with an emergency, there's so much involved.
Right. It's not like calm and chill. It's like probably neurotic.
Right.
And if you get put under general anesthesia and your partner is with you, whether it's your husband or your partner, they go straight into their skin to skin chest. Right. So they at least get it.
Like, I know we talked a little bit about recovery stuff. I know there's probably so much info out there, but walk us through some of like the programs or things that you do and offer that like people might be interested in if they're having a C-section, like what they could like find there and benefit from if they want to dig deeper.
So for sure. So the way that I focus in my recovery program is because of what I've been through, but I've worked with so many people over the last 20 years in person and online. And I realized that the recovery should be involved with 3 main components. It should be mindfulness. So helping you process your birth because you never get over it. It's not about getting over it, right? It's about working through it. So processing your birth, but also processing the changes to your body. That's a huge one because you're like pregnant. It's like, oh, so cute. You're so beautiful. And all of a sudden it's like, what the fuck is this? Like, what happened?
I agree.
And that you're never, going back to pre-baby. Ever. You have, this is the new you.
The new you, and especially with a cesarean, because now you have a scar.
Yes.
Right? That you would now have to make peace with, right? So I'm all about making peace and kind of working through and accepting wherever you're at. So there's the mindfulness part, there's the massage. So we're really focusing on scar tissue massage. Sure, you can go to an RMT and get them to work on it, but you need to work on it regularly. And you're not going for massage every day of the week. So learning
that would be nice.
It would be amazing. Learning how to work on your own scar tissue and feel in charge and in control of how that's feeling. Because, long-term chronic pain can happen with the lower back or with your scar. Numbness is very common around. So we teach you how to work through that as well with techniques called desensitizing.
I love that.
Yeah. And that's just using different materials around the scar to like stimulate the nerve in the skin to regrow back. And then movement, like teaching you how to move again for everyday life, specific movements, specific stretches that will combat any kind of ergonomical changes or dysfunction that you've created with like lifting. Maybe you're using your back muscles to lift things and not your legs. And maybe you're just like slouched all the time when you're feeding. And we teach you how to be more aware of your body so that if you want to go into a workout program or you want to start exercising, you have a really strong foundation. We've taught you how to work with your core. Your core system is not just doing planks, it's actually breathing. And you could do this breathing technique in postpartum at the hospital. Not everyone really thinks of it, but you can. It's gentle on the body and learning how to connect there because people who've had cesarean can also have pelvic floor dysfunction. Pain with sex and leaking pee are the very common ones. Not as much with prolapse unless you really push for a long time and you have other stuff going on. But those are very common. Everyone who has a baby, everyone in general should see a pelvic floor physiotherapist.
Everybody's saying this.
Oh, you're trying to wink at me and be like, Amanda, it's time. It's time to go. It's time to go.
Like all my friends, you just don't listen to me. I'm like, go.
I know.
It's not fun. It's not like going out for drinks with your friends.
I just pee constantly.
If there's a hand up your vagina.
They're the nicest people, honestly. Like,
they're fisting you. So I hope that they're the nicest people.
They honestly are the nicest people, and they're not like hitting it into the cervix. They're literally just going like a couple inches in to like push the muscles. They teach you about your body in that way. And it actually, like, learning how to do the proper breath work, and it improves your sex life, right? So,
well, if it improves your sex life, then now you got me there.
Now you sold her. There you go.
But these are your lady parts. You're gonna have them your whole life, and we can look at older generations and how they've suffered because they just didn't know, they didn't have the information, or we can actually take control and take charge now while we're young and healthy to not have to be in diapers. Like, there's been studies that show like the secondary reason why people get admitted to seniors homes because their families can't take care of them is because of incontinence.
Ew,
right?
It's really sad.
That's really gross.
So if they would have had access to things like pelvic physio when they were younger, not just surgeries, right, to fix things, but actual like rehabilitative things, then it could have changed their projection of their living as a senior citizen. So
if you have any pelvic floor, C-section or not, go fix it. Because you don't want to end up in old age.
You're really looking at me specifically. Like, you're talking to our audience, but you're looking at me like with that the eyes.
You didn't want to do it last time.
And everyone can find your program through Instagram.
So basically, we invite you to come to a webinar. It's called 3 Ways to Take Control of Your Recovery. And if you resonate with our webinar and what we have to say in it, then you're invited to either enroll. Sometimes I invite you to book a call with us or enroll into the program with us. It's a 12-week coaching program where you're being handheld the whole way. As you're doing the program, you have lifetime access to it, but we're walking you through those main components, but then also checking in every week for 12 weeks because taking care of yourself is easy when you don't have babies. But as soon as you start having babies, we prioritize our babies, and we need to get more in the mindset of filling our cup so we can fill the cup of others. We can't 100%. Be depleted and give to others. We can't. We're giving from an empty cup. So, put that oxygen mask like you do.
You took the words out of all our mouths. Put that oxygen mask on first.
Yeah.
You cannot be a good mom if you are like a shell of yourself.
Yes.
Exactly.
I love that.
And so many people are functioning from that shell, especially because they had a birth they didn't want or the postpartum experience they didn't want. And we deserve better. We deserve more. We deserve to get our lives back and feel like women and feel sexy and feel whole and be the best mom and be the best wife so that we just have families that are thriving and not depleted and stressed.
So
you said it all. You ended us off amazing.
I love
with
that. I love that.
I want to feel sexy and empowered.
There you go.
Why not?
I'm going to pelvic floor.
I'm going to follow up with you on that.
I know you will.
Now Amanda's new doctor.
I can send you to someone.
I love it. Amazing.
All right, Nicole, thank you so much. We had such a fun time with you. And to all of our listeners, go check out Nicole's page. Go check out her webinar if you're having a C-section or not, maybe, and you just want to, learn some other recovery tips.
You have an emergency C-section to have the knowledge of everything.
Thank you so much for having me.
Bye. We'll see you guys next week.